program is brought to you by End Fertility and IVF.
Hi everyone, I'm Anita Dilip. Welcome you all to another episode of Conceive. As we all know, each and every episode we cover various aspects of infertility. Today we are going to discuss about a very important aspect of infertility, that is about the relationship between male and female. Today we have an eminent personality, Dr. Anita Mani is here to discuss about the same. Doctor, welcome to the show.
Male-female relationship. I'm sure that the moment you heard the topic, you'll all be very interested and think that this is going to be a very hot discussion, and I hope we're going to have a hot discussion. We know that in order to conceive, we do need to have a male-female relationship. But there are a lot of things, which we need to know: biological factors, social factors, emotional factors. And I'm actually sure that Mrs. Anita, you are a counselor, that you will be able to equally contribute to this discussion as I do scientifically. So, in order for that we have a successful relationship, there are a lot of complex factors involved in it. For men, having a sexual or physical relationship is more of a physiological phenomenon, but for women there is a large emotional aspect attached to it, because the hormones are much more controlled in a woman with the emotional aspect, and the brain works differently slightly for men and women. There is a lot of physiological differences between men and women. So, it would be actually good that we understand the basic differences, then only there will be a unity. We need to know why men think differently. There's a book called Men Are from Mars and Women Are from Venus. I think that every single couple should read it before they get attached and they get married. So, let's see what are the basic differences and why there's such a huge difference between men and women. So, shall I start with the physiological aspects a little bit?
Yeah, sure.
Okay. So, let's look at the physiology. In women, it's basically the estrogen hormone is released from the ovary when the follicles are developing, and this is the female hormone which drives the women in her bodily functions and things. So, the estrogen produces all the libido and the desire to have a relationship with the men. So, only women who is fertile, that means her follicles are developing and the eggs are developing, the estrogen is released. So, the women in the reproductive age group who are ovulating, they have the desire to have the physical relationship. But what happens is that if a woman is not ovulating, they don't have enough estrogen. You see, in conditions like PCOS, polycystic ovaries, what happens is that women may not ovulate every month regularly. Some women do, but some women may not. So, what happens is that estrogen secretion does not happen in the cyclical way in which the normal woman happens. See, what happens is that if the estrogen does not go up cyclically, that they may not have the proper desire to have the physical relationship. So, we do often note that they might have a little bit of difference of opinion between the male partner when women have PCOS, and it probably is because of the hormonal effect. I do see some patients, like especially in metro like Bangalore, many of the patients have very poor relationship, either emotional or physical, between them. When they are working for around 12 to 14 hours, and especially in IT field, when they work continuously with the computers, they get mentally so tired, and there is very little time to bond with the partner. They hardly spend any time together, free time together. So, what happens is that I see patients who come and say that, like, we've been married for 8 years, we've been married for 10 years and we want to try for a baby now, but we are not interested in having sexual intercourse. So you ask me how frequently you have, they say that we've never had till now. You know, what is the point of being married and not having any relation for so many years? So it is not uncommon. I have to say that people who are extremely busy in their work don't have any physical relationship, or have, you know, once in a month, once in 2-3 months, which is not the normal physiological thing what is required for reproduction. In olden days, if you take, you know, people had much less stressful work, they had much more time together. So what happens is that the whole physiology of these hormones and, you know, everything is controlled from the brain. You know, we have a center called hypothalamus in the brain, and this hypothalamus is governed by all our thoughts, our actions, stress, and all the things affect hypothalamus. This hypothalamus produces some hormones which affects the pituitary gland in the brain. This pituitary gland will release hormones called LH and FSH that happens in both male and female. These hormones from the brain, through the circulation, through the blood, it will reach the reproductive organs. In women, it will reach the ovaries and make the ovaries to start ovulation process. The follicles develop, which releases estrogen, which is a female hormone. In men, this LH and FSH, it reaches the scrotal tissues, it will allow the development of the sperms, and testosterone is produced, which is the male hormone. So that is how the hormones get produced in the process of gamete formation. So estrogen makes a female think like a female, and they are attracted to the opposite sex because of the effect of the estrogen. And the male hormone testosterone makes a similar effect on the male person. If the person is overworking, the hypothalamus is affected, the pituitary stops producing LH, FSH, and then, you know, the ovaries and the testicles, they do not produce either the eggs or the sperm, and there are not enough hormones. So, you know, they do not feel the same physical attraction or attachment, so they become distant. So that is how the current scenario, you know, in the world, the stress and the overworking and all these traveling and everything together,
Stress factor.
it produces not just infertility because they are not ovulating, they have less amount of physical relationship, and that ultimately it leads to more marital, you know, problems. There is more discordancy between each other, there are more problems, there are more separations. So this is the physiological basis of problems happening now and leading to higher rate of infertility.
This program is brought to you by South End Fertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. South End Fertility and IVF.
This program is brought to you by South End Fertility and IVF.
Doctor, what we can do to rectify the present issue what these couples are facing actually?
See, when you think about it, you know that now there are a lot of changes after this internet has come. People are spending a lot of time on social media networks, and people are on
They are more comfortable.
smartphones
Yeah,
more
they're
time than their partners.
They're more comfortable in their online
Yeah.
world than their offline.
Line. Unless we come out of it, what do you feel? I mean, personally, what do you feel of the effect of the media?
Not only effect of the media and this, as you said, this smartphones and even the bonding between the people. Even nowadays, we can see that it is very less when we compare to the
Previous
past years,
generation.
generation. Why? Because they are more comfortable in, as I said, this world, and so the bonding between the partners are very less. And
yeah, that is what, when the bonding between the partners are less, the hormones are affected. So, there will be more problems in the field of infertility. So, we need to bring back the bonding between the couple, and for that, see, these things are all needed nowadays. You cannot go back to your medieval life and live in a forest. It's not simply possible. So, what I feel is that we need to know where to put the restrictions.
And that
we can use
we
internet, we can go on social media, we can continue on things like WhatsApp, but we need to know how much time we spend for that. We need to prioritize, as you said. We need to prioritize and spend only limited amount of time.
And we have to, I think we have to spend a quality time with the
partner, and not just send SMS or email to the partner.
Nowadays, partners are sitting in 2 bedrooms and they'll be sending messages
with each other,
communicate each other,
which will not be sufficient. So, when we look at the various factors between the male-female relationship, we can see that factors like working long hours, traveling for long hours, and probably these night works. Now we see that men sometimes have to work overnight, and a partner might be working at night and another partner might be working a day shift, and they never tend to even meet each other. So, these changes in the working atmosphere, and sometimes there is a lot of delay in women getting into a partnership because of the career, or even them separating for the sake of work, like migrating to another country and just visiting once a year or once in 2 years. That will definitely produce a lot of distortion in the reproductive cycle. So, I find that women having PCOS when their partners are working abroad, probably because they are not having regular relationships. So, it is quite important that being together, spending enough time, having physical relationship in a regular manner, it's important for the physiological functions also. So, I have actually written a blog on this, and I have given a lot of tips how you can improve this. So, one of the few things is that having a quality time together, that means doing outdoor activities, like you can go for a long walk, you can go for a holiday together, maybe on weekends, or you can have a small garden where you both work together. You could do exercise together, you could go for some dance classes together, you can do yoga classes together, because when you work out together, people they release adrenaline and steroids in the body, and endorphins. These are the things which are released, and when you
through positive thoughts and energy,
the studies show that when you are having high amount of steroids and adrenaline, you tend to fall in love, or you feel attracted to the person. So, do it with your partner, you go on adventure trips and all those things. Myself at this age, myself and my husband, we go for dance classes and we performed salsa and bachata. So, if I'm 45 nearly, and if I could do it, I'm sure that youngsters can do it. I'm a busy practitioner and I still find
different area actually than
I know, but I think it is again prioritization. You should be able to find time for your partner and spend more time. So, when you do that, the physical the proximity and spending time together, there is a release of oxytocin hormone, Oxytocin hormone helps in the
And the
reproductive
role
cycle.
of dopamine also.
Yeah, you know, dopamine is a chemical which is released from the brain, and they have shown that in a particular study that the part of the brain which releases dopamine from a physical relationship, it's very funny that 3 other conditions also release that. One is being in a psychotic state, another one is when you are actually under the influence of drugs. So, very funny that these things produce similar response in the brain. The pleasure center is responded in these 3 conditions, it seems. So, there are a lot of things beyond what we see that has made changes. When we look at our forefathers, you know, many generations back, what did they do? You know, you look at their daily life, there was no television, there was no there was no effective outside media, you know, there was absolutely nothing. But they used to, many of them were farmers, and they didn't have any of these luxuries that we have today.
They were more connected to nature.
But they were extremely emotionally attached to each other, our forefathers, much more than what we are now. And there were no difficulty. You know, they used to have 12 to 18 children, most of them.
Minimum 10 children.
Minimum 10 children. And I think these issues were not a big problem then. Nowadays, they say that you have sex everywhere, but not in the bedroom where it is needed, because it's all there in the media, everywhere, and probably not where it is needed. So, practical tips to spend time with each other, and your physiology gets normal.
This program is brought to you by South End Fertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF.
Doctor, could you please explain how to educate this public about the physical aspects of relationships?
The physical aspects, you know, and sex, you know, that word, I was not very sure that I can utter that word on TV, and actually, because, you know, people are so scared about it. It's a physiological need, just like you eat food when you're hungry, you go to toilet when you have needs. This is also a physiological need, but I don't know why people are so secretive about it. And I think very strongly I suggest that our young generation needs to be educated about proper physical relationship or sexual relationships, and that they know how to have safe sex to avoid having diseases like HIV.
In international curriculum, and students are, you know, taught this along with their curriculum, school curriculum in early stages. It's even from grade 6th standard onwards, they are getting proper education in this.
But yeah, that should be introduced all over the world, because it's very important that they should actually learn about it. See, there are basic differences. If you take a physical relationship, the amount, there are stages of sexual response which are somewhat different in male and female, and the time taken for a male person is much shorter than a female to reach the orgasm or the climax. So, it might vary from 3 minutes to 5 minutes to 10 minutes in a male partner, whereas in most of the females the sexual response cycle is much longer. It can take anywhere from 30 minutes to 1 hour for a female to reach the climax or the orgasm. The funny thing is that many of the male partners do not understand that there is a difference, and they don't even realize that females have something called orgasm, and the studies have shown that only around 20 to 30% of women feel orgasms regularly, or only 10% actually feel orgasm regularly, and 30% feel once in a while. There is a huge number of women, around 40% women never even gets orgasm because of the misunderstanding. See, only once you have reached the climax, both of the partners will be satisfied.
Connection to infertility something?
It is connected in a way to infertility, because unless you are fully satisfied, you will not be happy with your partner. So, it is important that the male partner understands the time difference that a female goes through to reach the climax. So, they need to spend much more time in the foreplay before they get stimulated, then only the time gets adjusted. Then again there are variations. So, you need to understand your partner so that you reach this thing, because there is a wide variation between the time and the process involved in this. So, there needs to be an understanding. And then the physiological part of it, if a woman reaches the climax or the orgasm, there is some extra changes in the reproductive organs, because the uterus and the tubes tend to have some contractions. So, while the tube is having contractions, that produces a negative pressure in the tube, which will act like a vacuum cleaner in getting the egg into the tube. So, there is a higher chance of having an egg in the tube which is ready for fertilization when the sperm reaches there. That means there is a higher chance of pregnancy if the woman goes all the stages of sexual response and stimulation, and it is not enough that only the male partner reaches the climax. So, for the actual fertilization process, it is important that both the partners go through all the stages of sexual response. There is so much more to talk about this topic. Actually, I don't think I will be able to give enough information on this topic. So, we will definitely do another topic on this. What do you say?
Yeah, definitely. Within this short span of time itself, we have given a lot of information, and we are really looking forward in another episodes. Thank you so much.
This program is brought to you by South End Fertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF,